When we go deeper and we see what drives inflammation and and as a result drives degeneration, we find the survival paradox. And why is it a paradox? We are all wired and built to survive. While we want to survive, the result of getting stuck in this survival response is actually inflammation, fibrosis, degeneration, and shortening of our life quality and our span of life. And that's really the paradox.
This is Dr. Talks.
Dr. Eliaz, I am so excited to have you on this segment of Regenerative Medicine Summit. You're somebody that there are a number of people that I consider giants in this field, and you are definitely one of them in regards to regenerative medicine and so many other areas. So thank you so much for being here.
Thank you so much for having me. I always enjoy talking to you and I learn a lot from our conversations.
Well, thank you. So I want listeners just to understand the wealth of knowledge that you have. Dr. Isaac Eliaz is a leading expert in the field of integrative medicine, specializing in cancer, detoxification, immunity, and complex conditions. He is a respected physician, researcher, best-selling author, educator, and mind-body practitioner. Dr. Elias partners with leading research institutes, including Harvard, National Institute of Health, Columbia, and others to co-author studies on integrative therapies for cancer, heavy metal toxicity, and others. He is founder and medical director of Amitabha Medical Clinic in Santa Rosa, California, where he has pioneered the use of therapeutic apheresis as an adjunct blood filtration treatment for detox and chronic degenerative conditions. Dr. Elias, I'm so excited because we're going to be talking about apheresis and then also some other components that I know that you've written an amazing book called The Survival Paradox, and we've been talking about the survival paradox protein, correct?
Yes, of course.
Yeah. So tell me a little bit about in your book. Yeah, you talk about the survival paradox protein, and you've been studying this for decades. In fact, you're even doing a study with National Institute of Health in regards to this protein. So tell me a little bit about this protein and how can it be is it good? Is it bad? Is it what does this protein do for us?
Right. So before we dive into the protein, it's important to understand the concept of survival paradox. And survival paradox is really a new paradigm. It's a paradigm shift from our understanding in integrative medicine, people like you and me, and now in conventional medicine because of the cytokine storm in COVID, that inflammation really drives, and it's a fire that moves so many diseases. But inflammation is really not a cause. Inflammation is actually a result. So when we go deeper and we see what drives inflammation and and as a result drives degeneration, we find the survival paradox. And why is it a paradox? Because we are all wired and built to survive. Every cell in our body, every organ, us as people, communities, our earth, etc. And as part of this, when we face danger, we respond innately and automatically. So the first level of response is through the sympathetic nervous system, through the autonomic system, because it's autonomic, we don't control it. And the sympathetic response has two basic parts. It fights, which equates to inflammation, struggle, friction, or it hides, it runs away, which creates to creating microenvironment, biofilm, fibrosis, where we create an environment in certain tissues that is different from the body's environment, which is ideal for the growth of cancer, of autoimmunity, of metabolic diseases. So while we want to survive, the result of getting stuck in this survival response is actually inflammation, fibrosis, degeneration, and shortening of our life quality and our span of life. And that's really the paradox. So we talked about the sympathetic response, which is innate, but deeper than this, the biochemical system react within minutes. I've shown in my phase 1 NIH grant that when we induce sepsis, In animals, we get galectin-3 spiking within minutes, and only later interleukin-6 will come up. And only later the kidney will get damaged. And when we blocked galectin-3 with pectosol, with modified cytospectin, we attenuated the IL-6 spike. We prevented the creatinine spike. We prevented the death of the animals. So we got this certain protein which are called alarmins. And the key one that I've been engaged in for almost 30 years, made some of the most important discoveries that blocking it with modified cytospectin will reduce inflammation, fibrosis, and as a result, so many other conditions. So this survival paradox protein, it responds within a minute and then it drives the process. So it's really the ultimate upstream protein. And the image I like to give is a waterfall. We are all trying to affect cytokines. We're trying to put down the fire, but it's really like putting buckets at the bottom of the waterfall and trying to catch the water. Much more efficient, Michael, to shut down the waterfall at the top. And that's what addressing galectin-3 does. So if we looked at the biochemistry of what happened when galectin-3 gets to the cell, it shifted from a normal metabolism to an emergency survival metabolism, from normal mitochondrial function, for example, to glycolysis, right? And as you know so well, as being an expert in integrative oncology, the Warburg effect is a hallmark of this issue. There is oxygen, but the cell is in a survival mode, right? It goes to this very rapid, 100 times faster, inefficient metabolism. So galectin-3 is like the alarm, it's like the bus or the train. It drives to the problematic tissue, and then it brings on inflammatory compound, growth factors, hyperviscosity compound, sticky molecules, and it drives metastasis, it drives the primary tumor, it drives autoimmunity, it drives metabolic diseases. So when we understand it, we realize that galectin-3, per definition, is antagonistic to regeneration. It drives degeneration. It drives destructive forces. Now, we need to fight, but just for a few minutes, and then we need to relax. It's a little bit easier with the nervous system because we can take a deep breath, go out to nature, meditate, listen to music. We shift. With the biochemistry, we get stuck in the loop. And that's what happens to people. And certain people have a tendency to overuse galectin-3, and they will have shorter lives. And certain people have much lower level of galectin-3, and these are the centurions. We know it's published. Centurions have a much lower level of galectin-3 in the blood compared to people in the 70s, 80s. And when you look at the 70s, 80s group, you'll see a few that have lower levels. Well, these are the ones who are going to become the centurions, you know. So when we understand it, we understand that if we can address galectin-3, and that's why modified cytospectin is really a foundational supplement. So while a lot of the work on it, as you know well, it's in cancer, we are just about, in fact, by the time this is aired, we will be presenting, so I can say, we presented in November in the equivalent to ASCO in Europe, our data on 18 months follow-up on biochemical relapse of prostate cancer. And people who responded for 6 months moved on. It's a multi-center trial already, and they used modified cytospectin 15 grams a day. And there was 90% benefit, 90, compared to the baseline 18 months earlier, where the one side effect is that people feel better, have less joint pain, have more energy, memory is better. So while the focus was on cancer, the whole role of galectin-3 in fibrosis, inflammation, and the understanding that galectin-3 is the driver of inflammaging, when you look at it, you understand, wow, if we want to regenerate, first of all, we have to stop the destructive process. You really can't you can't grow a plant when the fire is on. It's going to burn the plant. You got to put the fire. You got to cool the earth. Only then you can nourish the earth and things will grow. And that's how the body functions. So in this sense, we have on the very simple level this amazing protein, and that's why when you address it with modified cytospectin, all other therapies are going to be more effective. If you look galectin-3 research, there are about 10,000 published papers on every disease Really, it's called the big paper from 2018, A to Z, literally every disease. If you look at the publications on Pectosol, about 80 publications, so many health conditions. Why? Because we are addressing an issue really at the upstream inception. So that's one level. And then, of course, it's not as simple. Then we can see what can drive us to get into a survival crisis. And that's what we'll talk more during this interview. What gets us to not feel safe? What gets us threatened? If it's toxicity that is chemical, emotional, psychological, genetic, epigenetic, the environment around us, it all affects us. And that's the beauty of it. And you know so well, being in this for so many years, and I know a little bit. The more we hold the bigger picture, the more we can use very simple tools to get very powerful results. When you need to use a lot of tools and a lot of gadgets, there is usually a deficiency in the understanding. So Galactin 3 offers a window into a different understanding. People who read the survival paradox will tell me it changed my whole perspective about my health, including many, many doctors. And that's why I always get excited talking about it. I don't get bored, I've done a few of these summits by now. But then in regeneration, it's very important. In regeneration, it's a key factor. So my research with NIH actually is on pulling out Galactin 3 through therapeutic apheresis. It's the first time there is one device in cancer that relates to TNF alpha receptors. It's the first time that we're taking an apheresis device and we are literally pulling the needle in the haystack. The whole amount that can be pulled, in extreme cases, 200 micrograms. Okay, you can't see it with your eye. And we have shown, so we're actually studying sepsis and acute kidney injury, deadly acute conditions in the intensive care unit. So first, we're in the large animal sepsis model, then we're going to move into the clinic once we get to the regulatory phase. But it's really like pulling the needle and like the whole thing collapses. I'm so excited, because, so many years in my inventive, creative mind just to know, is it working or am I just crazy? So I'll find out. I'll find out. Hopefully I'll find out. It's quite a journey before I'll find out.
Yeah, because you've been working on this for decades, and to be able to get to this point and do these studies with NIH,
Right. Yeah,
that is just
definitely.
incredible.
And with some leading amazing researchers and clinicians, really from top universities, nephrologists, critical care doctors. Yeah, there is an excitement because it's amazing. Nothing has changed in the treatment of sepsis for like 30 years. Somebody has sepsis and their kidneys get damaged, 60%, they're not coming out of the ICU. 60. And what happened here, this is an extreme case, but the same thing happens on a minute, microscopic, homeopathic dose in inflammaging. And if we can change it, the body will naturally regenerate. The body wants to regenerate, but it needs to be given a chance to regenerate. And if it's always struggling, if it's always putting out fires, and after the fire burns, there is scorched earth. After we get cut, there is a scar. But when a baby gets cut, there is no scar because their regeneration quality is so much stronger. They don't have a lot of emotional, psychological, lifelong traumas, imbalances that create scarring. So really melting the scars of survival, which is one of the 3 chapters of solutions in my book, it's really a prerequisite to really regeneration. So we need to really create the milieu for regeneration to happen. With some of the tools that you use, you know what I'm talking about. Sometimes we don't detail it because of regulatory issue, what is behind you, but you know what I'm talking about.
Yeah, and it is fascinating. You're talking about the survival mechanism and the survival paradox. It's what kept us alive from the tiger eating us up. And it is a very necessary,
Totally.
hardwired component of our existence. Now, when we don't have a tiger to fight and we don't have to, play dead, now we have the normal daily stressors, but we react in the same way. We react with that, going into that inflammatory fight or flight mode. And by being in that continual state, then to escalate, we have then these survival paradox protein, the galactin 3, that's like continually being stimulating all these cells, and we are continually then in that shift in that inflammatory state to promote inflammaging, which is when our body degenerate faster, which is the opposite of regeneration. I mean, regeneration is when we don't have these inflammatory signals that are continually taking place. So tell me a little bit about the galactin 3. It's a protein, and you mentioned that it's the kind of the top of all the inflammatory signaling, like the IL-6 and Th2 and Th17 and mTOR and all these different things that we look at cancer, and probably NF-kappa beta and all these different inflammatory drivers. So how does it activate all these different things? I mean, how is it the biggest thing, and how did you figure that out?
Yeah, so initially my work was in cancer, but I noticed that people's blood pressure is getting better, their joints are getting better, then their memory, then realize, wow, it's attenuating inflammation. Michael, if you want, if you let me share, I'll show you a quick slide that really reflects it. So what happened, you have galactin 3, which is a protein, and then you have this carbohydrate recognition domain with the different ligands that you are going to come, and they're going to create a pentamer structure. See, if the one becomes 5, and then this nasty so here you literally get a lattice formation, literally a biofilm, literally what Virginia Livingstone was talking about, like decades ago. And of course, it's not only in a cancer cell, it creates a microenvironment. And then what happens, look at the ligands, right? So cancer ligands, immune disruption ligand, because it blocks the function of CD45, hyperviscosity, fibronectin, damage to the collagen, sticky molecules, right? It creates clotting and stickiness, blood vessel growth, damage to the nervous system, right? Neuroinflammation, NG2, AL3B1, big in cancer, GAGs. So with all of this, you suddenly get an inflammatory response, and this is why it's the upstream. It's the bus. You see, there are so many therapies, right, to address one of these components. But here, you are disrupting the lattice formation. You are stopping the whole process. It's so fascinating.
So it's like, because we have all these novel therapies, peptides, stem cells, and
Exactly.
all these kind of regenerative therapies that people pay a lot of money for. But obviously, like you mentioned, if we haven't stopped the fire, and then by try to throw regenerative medicine onto something that's still burning, there's only so far we can go, and obviously it's going to then revert back to where it was before. So the key to stop the fire, to stop the inflammaging, to address it at the top is crucial before you start doing all these other expensive novel therapies.
Yeah, completely. And I don't have the slide here about how galactin 3 controls on one thing, all the interleukin chain, and the other part, TGF beta. But I want to show you one more slide with your permission,
Please.
because this talks to you a lot in cancer. So this is really, down what we are doing. So you get galactin 3, there are galactin 3 receptors right here. So galactin 3 will disrupt insulin receptors. That's why it's so implicated in diabetes. It will downgrade P53 and PTN. You get AKT being activated on the cancer pathway, right? But you get AMPK, the adenosine monophosphate kinase, being blocked, because now you got mTOR1 activated. Well, guess what? The cell has a sense that there's no oxygen coming in, right? Because it's blocked. You get hypoxia-inducing factor, and then you got your PDK, pyruvate dehydrogenase kinase, what people want to know. You got your pyruvate being blocked. And suddenly, so this is, of course, the Warburg effect, but that's the abnormal metabolism in diabetes, in autoimmunity, in cardiac, in every chronic disease. So you understand, we are dealing with it right here, and I don't have this specific slide. You got the macrophage turning into inflammatory macrophage because they got a signal from galactin 3. or because they know there's a problem and they're excreting galectin-3. So right here, they are starting the process. So we are changing it before it comes to the cell, and we shut down this whole mess. And then within the cell, there are substances that help, right? Regenerative medicine. So metformin is used, berberine is used. The key natural compound intracellularly is honokiol, because honokiol from magnolia will upregulate P53, will block AKT, mTOR1, and initiate AMPK, and block HIF, and the TNF alpha and NF kappa beta. And that's why if you look, we are using now a lot pectosol and honopure, MCP and honokiol together in people with neuroinflammation. It's amazing, the feedback, like I've never expected. Why? Because we are blocking extracellularly and we are blocking intracellularly. So really what people have to understand is that when we shift the metabolism, we are creating regeneration. It's happening. An abnormal cell is becoming a normal cell. That's regeneration. Now, I know, you and I drift toward cancer. That's the idea of redifferentiation medicine in cancer, right? Can we get the cancer to become less aggressive? Can we make it feel safer? So both by reducing the survival drive of the cancer, so we talk biochemically, but no, when I work with people, when I do healing, it's like, and when they go into the cancer, what is not allowing the cancer to take a deep breath, to feel safe, to feel like it has to move fast, right? And people find amazing things. So everything goes. And what you mentioned in your very eloquent definition, if we create the right environment, we will naturally allow regenerative medicine to work. So for example, if we talked about therapeutic apheresis, why therapeutic apheresis is so dramatic? Because it's a selective treatment. You don't remove just blood or plasma. It's not plasma exchange. You remove selectively the bad lipids, the LDL, the oxidized LDL, the lipoprotein A, which really doesn't allow oxygen to get into the tissue, right? Drives strokes, heart disease, a silent killer, drives cancer. You remove the inflammatory cytokine and the positively charged toxins, heavy metals that are bound to lipids. Now, what does it do? It creates space in the place which is really inflamed. So for example, in cancer, you can give great medication if the area around the cancer is a very strong different microenvironment with no normal circulation, with a biofilm, which is really this lattice formation, medicine is not going to get there, right? So in Chinese medicine, we talk about helping blood circulate during the first 2 days of chemotherapy. It's an ancient concept of the same thinking. So we are exposing the cell, we're exposing the cell to the immune system. So for example, PD-L1 inhibitors will not respond if there are high levels of galectin-3. It's known, it's published. So you do the apheresis, you are changing the environment of the patient, then you give peptides. Totally different results. And now we are talking, Michael, we're talking high tech. But let's look at our body. When we come to this world to grow, the first thing we do is we take an exhalation. We let go. We detoxify. And only then we can nourish it. When we leave this world, it's the last letting go we do. We take an exhalation. If anybody watched somebody dying, this profound last breath, and everything changes. So we are built to detoxify. Our exhalation is twice as long as our inhalation. Our lungs, if we paralyze the muscles, will collapse, will exhale. So detoxification creates space for transformation, for the change of oxygen in the capillaries in the lungs, and for nourishment through the heart. And that's the process that happens. So when we look at regeneration, we got to look at it as a process that starts with the detoxification. If anybody wants to take a deep breath, you can't just go like this. You have to exhale. Now it's much easier to take a deep breath. Same concept. So understanding it suddenly makes what we do much more effective.
So with with apheresis, I mean, what does that look like for a patient? I mean, what does that kind of machine looks like? And I mean, is something that's
So
easy to do?
no, not at all. And it's really important. I have people who do this and do that and do IV there. It's like highly specialized dialysis. So it's really a specialty. It's what I focus because of my research. I mean, I still do my other stuff on one, but it's really a specialty to do it right because it's an expensive process because the filters are very sophisticated. You have to separate the blood from the plasma. Often you'll need a central line, special central line, unless there are good veins. So you pull out the blood, it separates the cells from the fluid, from the plasma, and the plasma goes through a filter. And what I do from an integrative point of view, I will run very specific IVs for the specific patient before, during, and after. So I create a whole process based on how much detox they can take. And I also develop different frequencies that are not the conventional frequencies of how to use it. And ideally, what I will do a lot is I will coordinate with other doctors when the patient comes. They get apheresis, and then immediately they go back to get their regenerative treatments. Of course, I do some of them in the clinic, like different peptides, but it allows patients to really be in a much more supportive place when they come and get, for example, cancer treatments, including alternative cancer treatment, because there's a greater exposure of the tumor. And it's very effective with chronic infections like Lyme disease, because my philosophy, unless it's an acute infection, is we are built to overcome infections. We just need to support the body. If we can overcome an infection by supporting the body, we really overcame the infection. If we overcome an infection by taking antibiotics, we suppress the infection. Sometimes it will kill it. Acutely, definitely. It hasn't settled in. But chronically, it is very rare for the patient to really heal. Just like we see in cancer, right? The patient who haven't done conventional treatments, a few of them, not a lot, they are the ones who really have the amazing, miraculous healing, right? Because the body still has its full capacity. So it's a dance between using integrative medicine together with conventional treatment and making it work better, which is really the goal of integrative oncology. It's not about the one in a blue moon amazing miracle. Everybody has this. It's about, can you help every single patient in one capacity or another? And that's doable, right? You know it so well. You're so experienced in this. Same thing with regenerative medicine. And regeneration doesn't always go in the order that we want. The regeneration may be emotional, maybe psychological, maybe in ways that we don't really anticipate. And as part of allowing regeneration to happen is not to have a preconceived idea about what is going to happen. Because the moment we have preconceived ideas, we are naturally limiting our possibilities because we already decided what's going to happen. And that's a profound statement, not easy to digest. It's about like it's almost like a surfer on a wave, and you're not they're like you're at the edge. And you're doing integrative oncology for many years, and I'm doing it. In times when there were very few of us, right? Now it's very popular because so many people do IVs. We were kind of alone, right? Often we would talk to ourselves, right? Once every few years, I remember there was a conference in San Diego in '92, Nutrition and Cancer. Patrick Quillan, who is a good friend of mine, he organized a great conference. When we have dinner, even 25 years later, I talked to him about it. Everybody rushed, wow, we got to talk to each other actually, finally. And so these were days when you kind of were in the journey. It was mysterious, it was creative, and it was at the edge. It was amazing. And so you want to keep this freshness because this is what regeneration is about. It's about things being fresh.
And it's important, like you're talking about the antibiotic and where we're suppressing the infection, or if we do, some of the chemo and all of that, and it's suppressing the disease process, but it's inhibiting the body's ability to develop intelligence in regards
Yep.
to what it's dealing with. So for instance, like you're saying, if we fight an infection and we do it ourselves, we overcame the infection, and we overcame it because our immune system, our innate intelligence was able to recognize what was going on and then shift the body back into a homeostatic, a state, to homeostasis. So by supporting the body with natural things where we then remove agents that are then causing the inflammation, and we are supporting the mitochondria instead of having it down regulated by things like galectin 3, then we are able to run at full speed, and we're able to create tissue that creates healthy joints, healthy skin, healthy hair. We
Right.
have in the when we do the protein folding, that requires a lot of energy. And that protein folding, that is what we need to create these perfect proteins to build tissue. And if we don't have that energy, if we have galactin 3 there that's down regulates energy, then they are going to be misfolded. And then we're not going to create the right kind of cartilage or right kind of bone or right kind of skin tissue. And then we can't regenerate. So it becomes so important to address that, and then to have a tool like apheresis to be able to clear all of that out. I mean, that's amazing.
Yeah, so that's like more of a high tech. It's a powerful tool. You can't. It doesn't matter how many chelation treatments or you do. It's another scale. But in the same time, on a more ordinary level, we have to understand we can't regenerate if the body is very toxic. And we all hear about it, and I'm aware of it. I've done a lot of pioneering work on heavy metals and published because modified citrus very active, very effective chelator of heavy metals, multiple clinical data that we published in lead and mercury. But as much as I was aware of it, and mycotoxins that are getting a lot of, no, we are all brainwashed that a little bit of pesticides is okay, It's like, it's okay, you can't avoid it. It's everywhere. And it's really not okay. There are no healthy levels of glyphosate. So one of the things in regeneration, we have to address pesticides specifically because they disrupt the gut lining. Glyphosate disrupts the gut lining. No, the gluten sensitivity epidemic in this country, so many patients will tell you that when they go to Europe, they go to Italy, there's no glyphosate. They can eat pasta. They can eat bread. It's gone. Well, guess what? You're not gluten sensitive. It starts with a G. You are glyphosate sensitive. You are Roundup sensitive. And those are other toxic parts in the formulation. So it's a work that I'm doing now, and we are just finished the first pilot of a clinical trial showing that we can actually reduce glyphosate, in the most acceptable urine test very significantly. It's a product called Detox. But I think it's very important. It's part of the same attention. So we have the biochemical level, we have the getting rid of toxins, and then on a deeper level, how can we use our mind resources? How can we use meditation? How can we use our regenerative organs, our nourishing organs, to change our body? And that's where meditation and mind body medicine becomes so, so important, especially for the regenerative process. I know from my own experience, and I haven't done it in the last 10, 11 years. One level is because I felt I got to a certain level of training, and second level, I'm too busy, and I hope to get back to it. That I used for 20 years, I used to go 2 to 3 months a year to the mountain and just meditate. And the specific training I had that comes from Buddhism was what we call effortless training. You don't do anything. You just let go of everything. And it would be, and I would do, I admit, I would do some very strong, I like to do a homeotoxicology with blood that I mix and inject. I would do like 6 weeks every single day until, and I would come out, I would look 10, 15 years younger, and everything would change. My skin, my body, my physiology, everything would change. And it was a very deep peeling off, and it brought me to the recognition of the power of healing through meditation. Now, I did it in an extreme, 10 years a day and hours a day. I don't expect other people to do it. It was part of my craziness. But it allowed me to refine certain meditative methods that I mentioned a little bit towards the end of the book, and really what I teach a lot in Israel, but now I'm going to teach as of next year, of 2023, of this year actually, in United States more. I really want to offer it because our mind really has an power to heal. an infinite healing power. And this is where, and the key shift is from a destructive, reactive, survival driven lifestyle that comes from our head, from our ego, from thinking, from figuring, from reacting, to our heart, where we connect with our heart and then we shift from reactivity to responsiveness, where we respond to stimuli with love and compassion instead of with struggle. And each of us has the ability to do it. So it sounds like very esoteric words, but you know me a little bit, I always bring it back to physiology. So if we look at our body, and I'm rounding up to 50 trillion cells, and it's an image I never get tired to share when it came to my mind, we got 50 trillion cells, 50 trillion. I mean, for people to get it, million times 1,000, okay, billion, okay, times 1,000, trillion, times 50. And each cell has close to 1 million reactions a second. So if you and I talking now and not falling apart is not a miracle, don't ask me what is a miracle. And the whole system works together in harmony. That's what we call mutual support, mutual respect. A cell knows it's going to be expressing itself, doing its work, and then it's going to go into apoptosis, another cell will come. When a cell goes into a survival paradox and wants to survive when it's not supposed to, it creates a microenvironment. It doesn't have to listen to the body anymore, right? And you start growing on its own. How do we call it? We call it cancer. The more ego-driven, the more aggressive it is, the more aggressive the cancer. So that's an example. And down to the cellular level, every cell has a membrane where it decides what's going to come in, nourishment, and what it's going to throw out, toxins. And it negotiates with the interstitial space, right? We talked about it. The only organ that is different is the heart. The heart is the only organ that accepts what every other organ threw out, right? All the venous blood from every single tissue. The heart doesn't say, I'll take from the liver, but I'm not going to take from the kidneys. Brain, I really like you, but the legs, you didn't behave today. The heart takes from everywhere. In fact, for the heart to give blood, it has to take. The heart has to take our difficulties, connect with the universe, with the infinite healing of the universe with the lungs, with the breath. The exchange goes on in the lungs, and then you nourish, right? Detoxification to the right heart, transformation with the lungs, and nourishment. That's what we talked about, how we come to this world, remember? A few minutes ago. It happens every second. So we are built to take our difficult, our suffering, what we don't want, transform it. So it's different than detoxification. When you detoxify, you're also producing toxin. When you transform, toxins are the wood of the fire of nourishment, much deeper quality of healing. So physiologically, we do it, even if we're not connected to it mentally, emotionally, psychologically. But because we have a physiological tool for regeneration and healing that has a huge electromagnetic field. The electromagnetic field of the heart, this shape, 100 times bigger than the brain. So it gets to every cell in our body. In fact, it affects people around us, up to 5, 10 feet. And then in a weaker way, it keeps going. Electromagnetic field goes forever. So in this sense, when we connect it with our mind, with certain meditations, then everything is possible. Because why everything is possible? Because everything is changing. The heart always moves. The moment the heart gets stuck, the moment it gets fixated, we are dead in 60 seconds. The heart always moves. The mind, another way, the mind always thinks, always stops and analyzes, exactly the opposite. And then it reacts. The heart accepts what it has, gives without discrimination through the aorta, and the first organ the heart nourishes is itself through the coronary artery. So it nourishes itself in order to nourish others and as part of nourishing others. And the last part to add to it is that the heart nourishes itself only after it finished its work. Totally selfless, right? It pumps the clean blood out and only then it goes to the coronary artery. I often say anatomically, we could have nourished the heart through the left atrium. The blood is clean there, right? And calmed and it stays there during the diastole. There's plenty of time for blood to really get in. No. The heart does its work and only then it nourishes itself. So when we connect to our heart, heartfulness instead of mindfulness, we connect to our infinite healing potential. And that's where regeneration happens. Because regardless of what toxins are coming to the heart can still send clean blood. But if we have a lot of toxins in our body, we won't be able to clean enough. We have a lot of toxins in the environment, we won't get good quality air, right? So we have internal inflammation, which we talked about, and we have global warming, which is global inflammation. Exactly the same. Just the skin thinks there is a boundary, but it's affecting us. So you can see how the increase in chronic diseases and inflammation is happening in our environment as much as in us. So for people who are, I don't want to put energy into the environment, well, you're actually putting energy into yourself. It's a good thing to do from a selfish, as the Dalai Lama likes to say. Being selfless is a very good thing from a selfish point of view. So that's what happens. That's really the ultimate regeneration. So for
I
the
love,
pain,
yeah, I love how, I mean, when you look at, like what you're doing is that you look at it on a cellular level, organ level, and you recognize that the way the body is structured, that it has a I should say it's a higher intelligence, and it is how nature intelligently worked to be able to continue to function and continue to exist, continue to regenerate. And when we operate in opposition to how we were naturally created, that is then we're driving disease and we are then impacting everything on a cellular level physiologically when we are operating spiritually and emotionally and mentally in an opposite for who we truly are.
totally, totally. It's really who we truly are. And that's why it's so, in one level, easy to get there because it's almost too simple to really grasp. Because, like you said, it's naturally who we are. We naturally have a heart that takes difficulties and give clean blood. It's who we are. We just have the head and the ego and toxins internally, externally, that makes us not see who we are. Exactly. And then the result is inflammation. The result is degeneration.
And we are talking about how in the regenerative process that it's not something that we can guide with our mind or tell the body that this is what you need to do. It is something that the intelligence exists already, and you have to allow that intelligence to play out, and you become an observer and just kind of observing the process. And by doing that, you give it the maximum potential to reach that regenerative, the peak, instead
Right.
of thinking that this is all I want to do. And now you're limiting the creation, you're limiting your body, you're limiting all these different processes. I love that.
Yeah, and this is very important what you said because you describe a physiological process, but you actually describe also a meditative process. Because when we meditate and we have an amazing experience, we tend to hold to the experience because it's amazing. But the moment we hold to an experience, no matter how amazing it is, we are limiting the next experience. And anything that we hold to eventually gets frozen and no experience stays. Everything changes. So the trick in meditation is to keep moving, to keep moving, to keep moving, not to hold to anything. When we don't hold to anything physiologically, our blood is less sticky. We have less hyperviscosity, we have less inflammation, we have less inflammation, we regenerate. That's why the power of regeneration, it's really infinite. And what I like to say, and it's true, is not everyone will be a miracle, but anyone can be a miracle because everything is changing. And that's why regenerative medicine is so important. This summit is so important. And the way you present it today, it's not about a tool, it's about an understanding. And about an understanding and about then dropping the conceptual limitation. Dropping. Every time when you feel that skepticism come in, it's our mind's limitation. We are limiting our healing. And it's a journey. It's amazing. I mean, somebody who thinks, who has created a lot of things and yet spend a lot of years just letting go. Because when you let go, you create space. And when you create space, you give an opportunity for things to arise. So when we want to melt a fixation that is at the root of survival, holding to what is always changeable, we create space, the fixation becomes looser, like cutting the ice into many pieces. But when we bring the warmth and the love and compassion of the heart, we're just melting the fixation. And that's why compassion and the wisdom of spaciousness work together to create this infinite healing potential. When we can come from this place, then less dramatic tools become more dramatic in the results. And that's really at the essence of true regenerative medicine, because we regenerate every second as long as we let go good enough. If we don't detoxify well enough, if we hold to our emotions, if we hold to our thoughts, if we hold to our opinion, we're limiting our regeneration, our renewal, our rejuvenation.
And that's when the breath, becomes such a powerful tool, because it becomes a programming of the rest of the cells and rest. If you have an expansive breath and create that expansion to open up for possibilities, for where you don't hold the judgment, where like in Buddhism they talk about craving and grasping, and we need to kind of let that go and just allow and open up and breathe.
And the breath is incredible because the mind is hard to change, but we have to breathe. And the exhalation is passive. So the exhalation is a process of letting go. And at the end of the exhalation, there is this gap between the exhalation, which is passive, and the inhalation, which is active. And in this gap, there's a very big place of stillness. So we use a mechanical letting go process, and we let it guide our heart and mind. And that's why the breath is such a good tool for meditation, where the breath allows us not to get distracted, the exhalation, and this small gap allows us to let go, but not let go too long so we don't get caught again in the mind, because the next cycle of breath is coming. And that's really what happens in life. In Chinese medicine, we define longevity not by how long we live, but how many different things we have done. So in order to do something different, something new, we got to let go of something old. And the breath does it. The breath exhales what's letting go. And now there is space for something to come. And that's why the breath is so key in every tradition. But today we're looking at it from a regenerative, based on the topic I talk about, I will shift the explanation to the
Yeah, and getting away from that. Because we need now, when we live in this modern society where we have stimulations all over the place, and the body looks upon that as threats. Whether it's 5G, EMF, things from CNN or whatever it is, there's always something that is a
Right.
threat. So we need then to be able to shift away from being in that threat state, that survival mode. And that is, because yes, we can do, modified citrus pectin, pectosol C, we can do apheresis. So all these things are great to bind to the galactin-3, that drives the inflammaging. But even before that, we don't want to create galactin-3. We want galactin-3 as a survival mechanism, but we want them in short spurts. Like when, we need to run away from the tiger, but when you see animals, they don't keep running after they are saved from the tiger. Now they rest. Now they heal and regenerate. But we keep on running.
Cool.
Yeah. Great. Well, Dr. Eliaz, I'm so grateful for everything that you're doing. This is such peaceful and powerful information. And to me, this is the foundation of regeneration right here. And then you can build upon that. But this is a foundational piece. And so thank you so much for describing it and giving it such a great visual for people that are watching.
Of course. Thank you. Thank you for the opportunity.
Thank you.
Take care.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, And join us next time on Doctor Talks. Real talks from real doctors on the issues that matter to you most.